أشهد أن لا إله إلا الله وحده لا شريك له وأشهد أن محمدا عبده ورسوله. Dear viewers, Assalamu alaikum wa rahmatullahi wa barakatuh. You're most welcome to this program, Health Check, a program which is put for you, which is expected to discuss a lot of matters concerning health issues. And I have a doctor in the studio who is Dr. Akatulinda Abubakar. He's an expert in infectious diseases, and he's going to help us understand a topic, very important one, which is hospital-acquired diseases or hospital-acquired infections. Because there are so many people who go to the hospitals and they have one disease, but again, when they come out, they have more than two diseases, of which others are acquired right from the hospitals where they went to get treatment. Doctor, you're most welcome, and I would like you to introduce yourself to the viewers more.
Yeah, thank you so much, the host. I'm Dr. Beka Katulinda, and I'm happy to be here. Good evening, our viewers. Thank you for tuning in to watch us. We are here to discuss about our health, and I believe by the time we finish this program, you'll have gotten an idea or two or more which will better your life than you are now. Together, we can live a healthy life. Together, we can live a better life.
Thank you so much, Doctor, and you're most welcome to this program. To start right away, can you give your overview about the hospital-acquired infections?
Like you have mentioned it, hospital-acquired infections. These are infections which a person gets in their stay in hospital.
Okay.
Going to hospital with one disease and coming back with two or more.
Okay.
Going to hospital when a person is not sick, so bad off, and comes when they are more sick. Okay. Or just going as a caretaker to escort a patient and you go back home when you are also sick.
Okay.
So that is what we are going to share today, because it is a very serious concern which is usually undiscussed or it is under-discussed. Several times people overlook it, they discuss diseases, but they miss this concept of going to hospital when you are normal and you go back home when you are sick.
Doctor, this word infection, I don't know if it is a technical term, but most times people go to the hospitals and they think they have malaria, they think they have any other disease, but again when they get tested, they tell them you have infections, as if the word infection is a very broad term. So can you please throw more light on what infections are, or if there are some types of infections for that matter?
I can say infections, let me say like this. All diseases, not all diseases are infections.
Okay.
For example, you can't go to hospital when you don't have hypertension and you come back from hospital when you have gotten it.
Okay.
No. You can't go to hospital and you come back with diabetes. Okay. Although diabetes is a disease,
no,
but you can't acquire it from hospital.
Okay.
So diabetes is not an infection. So these hospital-acquired infections are the ones which a person can acquire from another one, which are transferable to another person.
Okay.
Let me say through touch, or through air, breathing air, or through fluids like that.
Okay.
That's what we can call infections, which a person can acquire from hospital. So not all diseases can be acquired from hospital. Like I said, you can go to hospital and come back with diabetes. No. But you can go and you come back with malaria.
Okay.
You can go
because you may find mosquitoes there.
Exactly, and they bite you. They bite a patient of malaria, they also come and bite you. So these infections, you can acquire them when you're in hospital, during your stay in hospital, before you go back home.
Okay.
Yes.
So now can we talk about the causes and some of the risk factors that cause these infections in the hospital?
Yes. This is very, very important to note, because once we note, then we shall get a way of avoiding them.
Sure.
The commonest risk factors for this is immunosuppression. when a person's immunity is low,
Okay.
the lower the immunity, the lower the ability to fight
Okay.
the disease-causing organisms which invade our bodies.
Okay.
As I explained this, I will give an example of tuberculosis, TB. For example, if you go to hospital, for instance, and you go in the TB ward, the patients there have tuberculosis. And every time they are coughing out the pathogens, bacteria for tuberculosis. Now, if your immunity is strong enough, it will fight them and overcome them, and you go back home the way you came.
Okay.
But if your immunity is low, in other words, the lower immunity, it will put you at a risk of getting this tuberculosis. Sorry.
Okay.
So the low immunity levels is one of the risks of acquiring these diseases in hospital. Another risk factor is the prolonged stay in hospital. For example, a person who is on ward is there day 1, day 2, day 3, day 4. Even if your immunity is strong, it might be compromised because of too much inhaling of the tuberculosis in that example. But also other diseases, other infections which can come up when you are staying long on the hospital bed or when you are admitted, the infections can come in. There is another risk factor of if you have undergone surgery, the surgical site can easily be infected because it is exposed to pathogens, to microorganisms which cause disease. And that can put a person at a risk of getting the diseases. Another point is those patients who are using catheters. Catheters are tubes using to assist in urination. If a person has urine incontinence or is unable to control urine, we put a catheter to help the patient urinate and also help us to monitor the urine output in the patient. And therefore, if a person has that, for example, a catheter, and they take long with it, it can easily result into infection in the urinary tract. And that can easily lead to a person getting an infection acquired in hospitals. Another factor also, these factors may cut across both the hospital management or the patient at a personal level. Now, this point I'm going to talk about is about the hospital. The overcrowding of hospital wards can highly predispose patients to acquiring the hospital-acquired infections. For example, if a room which is supposed to host like 5 patients is now hosting 10, then it means you may find even 2 patients on one bed, which is completely illegal in the medical practice. But I'm giving an example. In case imagine such happens, then this patient may easily contract the infection from a fellow whom they are sharing a bed or whom they are near each other. And therefore, overcrowding leads to these hospital-acquired infections. I can also talk about the amount or the way a person is getting treatment or adhering to treatment. It might be the patient himself or herself not taking the medicines as required, or it may be the hospital staff, the medical staff, the nurses not giving the medicine in time. Now, this will predispose this person to lowering immunity and thus getting the hospital-acquired infections. So there are very many infections around there, but basically, when a person is in hospital, they have low immunity, overcrowded, maybe they have a surgical incision site, maybe they have a catheter, they have a tube in situ, a tube in the body, say for draining pus. All those factors are risk factors which can bring about hospital-acquired infections. But before we leave this topic, I can't fail to mention hygiene and cleanliness.
Sure.
We always encourage our patients to ensure maximum hygiene as in hospital. That's why it is a requirement of hospitals to have running water. That's why we have bodies which regulate hospitals and clinics and private medical centers. For example, if they find that you don't have running water, then the patients will not bathe, and thus they will transmit infections to their fellows. So hygiene is very important. And also the sanitation of the hospital ward, the hospital environment matters a lot in preventing or managing these hospital-acquired infections. And therefore, a dirty hospital environment is a risk factor, a high risk factor for the patients acquiring infections while in hospital. And though you may go to hospital when you are not sick, you go home when you are sick. Or you go to hospital with one disease, you go back home with more than one disease.
Sure.
Those are risk factors.
You talked about the hygiene of the people who stay in the hospitals, but also I think there is also a scenario whereby the hospital itself is not keeping itself in a clean way, where especially the washrooms.
Yes.
There are some hospitals which don't mind about the washrooms. We find people are just going there and coming out. There are no people who are responsible for cleaning those places. Don't you see that it's also a factor?
Yeah, and thankfully, I am hopeful that this program is seen by both lay people and also medical workers, maybe government authorities across the world. Let it be a burden upon all of us to join hands together and fight this. Because yes, a patient may be trying to be hygienic, but the hospital is not cleaned. The toilets are not cleaned. Still, they will get infections in hospital. And also some medical workers, out of negligence, they don't use their PPEs correctly.
Okay.
PPEs means personal protective equipment.
Okay.
Take, for example, a person uses a glove on one patient. The patient has a disease on the skin, and a doctor or a medical worker uses a glove and now doesn't remove.
Okay.
They use the same glove on another patient.
Okay.
Very dangerous, very bad. So that can lead to the spread of this infection from one patient to another one. This one who came to hospital without this disease may end up going home with it. So it is a combined effort for both patients, hospital administration as well, to combat this.
So, doctor, what are some of the consequences or the effects of acquiring these diseases in the hospitals? Do you think it can even, is there any way it can disrupt the treatment of this person who went to receive a treatment, but again receives another diseases or other diseases or infections? What are some of the consequences or the effects?
Yeah, absolutely. These hospital-acquired infections have dangerous effects on patients. Number one, they may prolong your stay in hospital.
Sure.
If you had come to spend 3 days, now when you get more infections, now the doctor may decide to avoid spending more days, as now we treat this newly acquired infection. That's number one. So prolonged stay in hospital. Number two, it may lead to more expenditure in terms of finances, because you are treating one disease, now you are treating two. Yes, now they become two. So you spend more money than you are supposed to. Number three, the hospital will make more expenditure in terms of drugs and necessities working on you, working on a patient who has acquired another infection. And therefore, the hospital itself will make a loss.
Okay.
In its doing so, this brings us to another point of the image of hospital. Each one of us, me inclusive, imagine I go to hospital when I don't have this disease and I go back home with it. Definitely, I would rather not go back to that hospital.
Sure.
It becomes so terrible and so unfortunate if this hospital infection,
that hospital becomes a disease donor.
Exactly, a disease donor, and it becomes now unfortunate that you may fail to go back in fear of acquiring another disease.
Sure.
So the image of hospital is tarnished. And also number three, it can also lead to complications of a disease. I'll give a simple example. If a person goes to hospital with just cough, just a normal cough, but because, God forbid, a person has raw immunity already, they get in touch with tuberculosis patients. Now tuberculosis sets in. So it means the chest infection which a person had, the cough which a person had, now becomes severe.
Okay.
So a disease which a person has, its stage may be increased, its severity may be increased by the acquisition of the new infection. And therefore, it makes a person get a severe disease when they actually never had the severe disease. Then the last complication we can talk about is death.
Okay.
These diseases can kill.
For
We
sure.
can lose a life.
For sure.
Yes.
Let's talk about also prevention, because when we understand how we can prevent this, perhaps there are some problems or diseases which may not come to us, or which may not infect us because of some knowledge about the prior knowledge about them. So can we talk about prevention? Is there any way that the hospital management can mitigate the occurrence of the infectious diseases in the hospitals?
Yes, very, very important. Like I always say, prevention is better than cure.
Yeah.
Prevention is affordable, or you can say prevention is cheap, and cure is expensive. And
sure.
therefore, any disease, any condition, it behooves us to take caution and prevent it, than wait for it first come and hit us, and we go to managing it. So one of the prevention measures is, one, let's ensure, as a hospital, needs to ensure cleanliness of the wards.
Okay.
Cleanliness. The cleaners must be there 24/7.
Sure.
They should ensure the ward is always clean. When a drop of blood drops on the floor, they should easily and very fast remove it with jig and clean water.
Okay.
To keep the place sterile, the place safe from infections. If saliva of a patient mistakenly falls down, if, say, pus falls down, if, say, urine or any fluid falls down, they should be mopped and cleaned very well. And also to ensure regular change of the bed sheets, let me say beddings in hospital.
Okay.
This is very important because it will keep the beds clean and safe from diseases, and therefore preventing it. And also I can't forget to mention about continuous medical education. Perhaps this may go to hospital administrators and hospital management committees to make sure that their medical staff, their nurses, are always up to date, are always reminded to be clean, always to put on their protective gears, always to have their face masks on, always to have their gloves on, and to change them every time they are shifting from a patient to another. It is very unfortunate for you or anyone to go to a doctor and the doctor coughs before you. It looks very embarrassing and very shameful. And you go back home with cough which you didn't have, or the medical personnel coughs at you. So it is very important for the medical workers to be updated always about the ways of reducing these infections. Perhaps we can talk about the patient's ways also of preventing this.
Yeah, sure.
Because these diseases are two-way. They can come out of factors, out of hospital factors, or out of patient-related factors. So anybody who goes to hospital, really, they need to ensure that they are always clean themselves. Every morning, they should bathe, they should brush their teeth, they should always make sure they are clean. And in doing so, they will not get more infection. And whatever they have, say, if they are sick, they will not spread it to another person. And so they will keep a minimal risk of transfer of the infections. And also, too, we should keep our bodies strong, healthy, to eat healthy diet, to keep our bodies strong. And therefore, when you go to hospital, you are at less chances of getting infected.
Yeah, doctor, there are also some ladies who know themselves that that they have a low immunity system, and they know that when I share another bathroom, which is shared by many people, I must come out with some infections. So what are some of what can you advise such people?
Yes, like I said, we couldn't explore all the risk factors for these infections because there are very many. But that is also a serious threat in hospitals because most hospitals use toilets. So when a person goes and flushes, another person goes there, they may easily contract the disease. And therefore, it would be best if we had private hospitals or a person used a private room where the toilet is used by one person.
Okay.
That can be better to mitigate the spread of those infections. But now in the countries which are still developing, people may have less money. And that's why also economic stability is very important in health, in medical. Once a person has enough money, that's why in some developed countries, I believe in the US and UK everywhere, such places, a person goes to hospital and they are given a room, fully self-contained with a bathroom, a toilet, it's only theirs. So if a person has this infection, he will keep with it as the doctors are managing it and won't spread it to another person. So, but in the most African countries which are still developing, it is a challenge, but it also behooves us to try as much as possible, the cleaners of hospitals, to clean toilets regular as possible.
Yeah. How about when this lady goes with a bucket? Can also bucket contribute to the infections, or there's a way they can help?
Okay, those are improvisation means which are welcome actually, because if a person has her own personal, may not be a bucket, but any personal equipment to use for short call or long call, that is absolutely better, absolutely good, because they will be secure from acquiring infection. After using it, very well and keep it by herself, not to share with others. So that is also very good, and I would encourage our viewers, in the case you're not having enough money to have a private room in hospital, you can use your own bucket, you can use your own equipment to reduce the risk of acquiring these infections while at hospital.
Respected viewers, this is your program, Health Check. We are checking your health, and this is the purpose of this program. We want to discuss some of the health issues which people find themselves into and they cannot extricate themselves from. Yes. So with this program, I think you've had enough right from the beginning of this program. If you've been with us, I believe that now you have a lot. Infections which are acquired in the hospitals are actually very common, and I believe that everyone is a witness that they have ever witnessed this. I mean, they have ever gone through this experience. Doctor.
Yes, sir.
In conclusion, because also time is on our side, is not on our side, can you share with us some of your experience as a doctor concerning this disease?
It is very, very unfortunate for a person to go to hospital and they go back more sick than they went. And therefore, it is the duty of all of us to ensure we fight it.
For sure.
Personally, I've had patients who come to hospital and they go to toilet and they come back tomorrow and they say, Doctor, I came here with malaria, but now I have a UTI. UTI is urinary tract infection,
for sure,
which they acquired from the toilet. And it disappoints so much when you're a doctor and you are infecting patients.
Even though you are looking for money in return, but still you feel it hard.
So it is paining so much. A patient tells you, I got sick when I came to your hospital.
For sure.
And it is very painful. And all of us need to wake up this time round to make sure we restrict, or we do all means to restrict these infections from infecting our patients. Okay. In all, I will encourage all of us to join hands and eat well, so that to have a healthy body, to have a strong immunity. I would encourage each of us to do regular checkups, so as to avoid having these diseases, because the person might have gone to hospital and got some UTI and doesn't know. So when you do some checkup, you can easily tell before it becomes severe. And that's I encourage each one of us to continuously do checkups and continuously eat safe, eat healthy, so as to have strong immunities.
Doctor, thank you so much. And I don't know there is any way I can thank you for sharing such a very important information to our esteemed viewers out there, because everyone, I'm very sure, needs this information. Only that it is very hard to get, even when you go to the hospitals, to see a doctor to explain to you these things is very costly.
Yeah.
And you may find yourself only being checked, treated, and then come out of the hospital. But with these programs, actually, we thank you so much for sharing this very important information. Unless there is any other thing that you would like to talk about, then we close today's program.
Dear viewers, I'll repeat again.
Now,
Dearest viewers, I repeat, prevention is affordable and cheap and better than cure or management. Cure is more expensive, more costly, more stressful, and therefore let us do all we can to prevent these hospital-acquired infections. When you go to hospital, make sure you don't touch those walls, those chairs everywhere. Restrict where you are. If possible, have your mask on. Do what you're supposed to do. If you're a patient, adhere to the rules of the doctors. Make sure you're always clean. Ensure your bed is clean so as to avoid these infections. Together, we can prevent hospital-acquired infections.
prevention is very cheap, cure is very expensive. This is a very strong slogan, if I can mention it. Prevention is very cheap and cure is very expensive. Thank you so much, Doctor. And esteemed viewers, this has been your program. Let's take care of ourselves. Make sure you're safe. Make sure you're clean. Your environment is clean. When you go to the hospitals, make sure all the things that you use in the hospitals are very clean. Eat very well, as the doctor has explained everything to you. I am Swagude Twahir. Let us meet next time, inshallah ta'ala. Assalamu alaikum wa rahmatullahi wa barakatuh.